Most people know me as the founder of a patient recruitment company here in the UK. I built that company with the core focus on diversity and inclusion long before it became fashionable. And that's always been my driving force. But titles don't tell the whole story. I've spent my career inside healthcare agencies across the full spectrum, from research and development, brand launches, market access, medical affairs, to commercial strategies. I've seen what works, I've seen what doesn't, and most importantly, who gets left behind. So why do I continue on this journey? Well, that runs a bit deeper. See, I'm the son of immigrants. My dad came to the UK in the early 70s. My mum came in the late 70s. They had an arranged marriage. First time she saw my dad was the day they got married. I still can't quite get my head around that. But when they started off their married life, they didn't have much. But what they did have was grit. My mum worked in factories like Wall's Ice Cream, Rakel Decker testing vinyl records. She later moved into a clerical role. Every step earned, nothing handed to her. In the case of my dad, he became a TV engineer in the 70s. He always used to say I had an option between TVs or computers, and he thought TVs were the future. The two of them worked 12-hour shifts. They did overtime. They worked weekends. They skipped holidays. They scrimped and they saved. So I could have a shot at a brighter future and not go through the struggles that they had to. But do you know what? All that hard work, it came at a cost. My dad was diagnosed with prostate cancer at 52. My mother was diagnosed with thyroid cancer at 48. Both way too young. Both let down by the system. Where it comes to my dad, he knew something was wrong. He pushed for answers for over a year and they didn't listen. And when they finally did, it was too late. His diagnosis was terminal. I remember it vividly. I was 17, sitting in a hospital room. The consultant comes in and says to me and my mum, 6 months to live. He hands us a flyer, says we'll get a follow-up soon, but there was no pathway, no options, no care. Me and my mum walked out of that room dazed, silent. We had family friends. We had family in the UK, but we didn't have advocates. We didn't have the right kind of support. We didn't know what questions to ask. Didn't even know what we didn't know. My dad, he held on for 6 more years. He knew he wouldn't see me marry, so he just wanted to see me graduate from uni. But sadly, he died 6 months before I did graduate. And that will always sit heavy with me. My mum didn't spot her own cancer. She didn't ask for help. She didn't know how. She just kept going, like so many working class people do, until her body just gave out. And that's why I do this. Not because I have read a regulation or a policy, not because someone has hired me to, but because I've lived the consequences of being unseen, unheard, and uncared for. Everything I've done in my career, every keynote, every campaign, every late night, it's been about one thing, and that's representation. From key opinion leaders to patients from underserved communities to just people. And I've tried many different routes. I've built things, I've burnt out, I've rebuilt, and you know what? I'm still here. I'm still building, I'm still believing. So yeah, this is me, Ash, son of immigrants, built from graft, fueled by grief, powered by purpose. And if this story connects with you, I'd love to hear yours too.